Hello, everyone. Thank you so much for joining us today. We're going to be talking about policymakers and partnerships and building the political will to end TB. So many of you may know that a couple years ago, the Global TB Caucus was formed at the Union in October in 2014 in Barcelona. And you'll be hearing today from many of the members of Parliament that are founding members of this caucus, but also from members of civil society and other groups who've been engaging them. As we've heard the last few days, people often call TB sort of the orphan disease. When compared to HIV and malaria, it gets significantly less resources, there are fewer political champions, and there are fewer celebrities talking about it. But we really, really believe that by engaging policymakers on the issue of TB, that we can make a major difference, starting local, going national, and then international. So I want to make sure there's a lot of time for question and answer today, but hopefully by the end of the session, you will have learned more about how to work with policymakers, the types of arguments and I guess persuasiveness that you can use when talking to a policymaker about TB, how policymakers have gone to start TB caucuses in their own countries and how you might be able to do that in your own country if you don't yet have one. And then talking directly to the policymakers and members of civil society who've been working on this. So without further ado, I would like to call upon Ruth Labode, who is an MP from Zimbabwe, and she's going to be talking a bit about how she formed a TB caucus in the parliament that she works, and her engagement actually on a regional level as well. So thank you so much.
Thank you.
Come take the stage.
Thank you so much. I thought I was talking about the role of Parliament, but I can talk on both. I'm a medical doctor, a public health specialist. Some years back, I ran a TB isolation hospital for almost 4 years. That doesn't mean now I then did not stigmatize TB, because in the past few days I've been analyzing how I looked at it. And for me, at that time, because there wasn't so much MDR and XDRs, we never actively also looked for cases. You were diagnosed by a hospital, then sent to me. I put you on treatment. When you were sputum negative, I sent you back to the community. So for me, it was a curable disease. So it didn't need a lot of noise. So now I'm a parliamentarian. I chair the Parliamentary Committee on Health, and I'm a co-chair for the SADC region also under the Global TB Caucus. So where does the Parliament get its mandate from? Parliamentarians are strategically positioned in society. We represent people, and people love to hate us. But also because we are, especially Africa, we're an authoritarian system, we just love parliamentarians and to give them a lot of respect. We report hospitals every second to parliamentarians that, oh, this is not there, drugs are not there. So that makes them in a position where they can actually monitor certain things. Parliamentarians are also affected and infected by tuberculosis. Either you're affected because part of your family members, especially if you come from Africa, you definitely have had family members that have had TB, or you have been infected yourself. So that makes us partners and interested parties. And that role helps us to destigmatize. Please, Nick, I hope I've not massacred the Queen's language. But that actually, for me, it means we are in a position as parliamentarians to remove stigma. If only we can then start working at a community level, talking about TB in our political meetings, talking about TB in all forums that we have. And one of our official mandate, which comes from the Constitution, is that we play the oversight role over the ministries of health, which includes TB. Literally, it means I can actually summon the NTP manager and ask him if I have a strategic document that they are working on and say, how far is this? Have you got these drugs? Based on what information coming from the civil society, having reported to the NTP, or from community. Then I summon, even the minister himself I can summon, to come and explain himself why there are no drugs. We also look at, we approve budgets as a parliament. I don't know how it works in other places, but in Zimbabwe, as I'm leaving today, the whole weekend I'm preparing to present a critique on the health budget that is being presented to Parliament. Then I'll make a presentation to a team of 600 academic parliamentarians and private sector. I'll cry, or I'll say, okay, I'm happy with how much has been put for disease control and TB. That is the opportunity I have at my level now to actually push for more domestic funding for TB. And we also use, we have a very good relationship with the NTP, and I go through their impact surveys, which they do the prevalence surveys, and those give me an idea where what the money we are putting in and the money the Global Fund is putting in, is it delivering anything? Is there an outcome? This means actually we can push for an increase in the budget by refusing to sign it. If the parliament does not pass the budget will not become law. But of course, there's what happens in parliament. Probably Nick will tell you there's what is called the whipping system, which is not so strong in Europe, but it's very strong in Africa because you come in through a party. So if the party says ignore the other party that is saying this money is not enough, then the budget can pass without you agreeing, but you can keep pushing through motions in parliament. And also members of parliament are influential members of, sit on influential international boards, like the International Parliamentary Union, the Pan-African Parliament, the AU, the SADC. Through these bodies, as a parliamentarian, you can actually push certain solutions. One of the big problems in the SADC region is cross-border transmission. Countries which are not doing very well economical, people run across and live in the neighboring country, in this case Zimbabwe to South Africa. When you get to South Africa, you are illegal, you live in terrible conditions. When you catch TB, then you go to a hospital. When they now ask you for your ID, the following day you disappear at night from the hospital, back to Zimbabwe. When you get to Zimbabwe, because you've taken medication for a week or so, you are feeling okay. So you don't bother going to the hospital. When then you start coughing, you go to the hospital in Zimbabwe. What I'm telling you is what I saw. I experienced it when I was at the isolation hospital. You go to the hospital, and then when you feel a little bit better, you cross back to South Africa. Now you're an MDR or XDR, and now you go on the statistic of South Africa. And this is why, specifically for Zimbabwe, my home, Bulawayo, which has a lot of our people are in South Africa, we also have the very high MDR in Zimbabwe. In my city alone, we have 100, which is too much for one city. And we know the reason. It's this movement. So we are pushing the SADC ministers of health to say, can they remove this requirement that if you fall sick in South Africa and you're illegal, you must be treated until you're okay, and then nicely deported with a letter to where you're going, so that people will not run away, because it is a big problem. And also, we have a lot of meetings within the country where we meet and have as multi-sectoral committees. And for me, this is very important, because this is what I think made HIV kick. If you remember very well, when the HIV came, there was a lot of social marketing. There was a lot of testing and counseling and testing everywhere, every corner. Our malls, our busy malls used to have all these mobile testing center where people were being counseled. International trade fairs, there was a counseling center. When we were in South Africa, Honorable Motsoaledi, the Minister of Health, actually took us to a church, took the caucus members, the Africa Caucus members, to a church. And while we were praying and praise worshiping, outside people were being tested for TB. And for me, this is what TB lacks now. time has come where in country, we must have, I'm told in Kenya there's something called the TB Summit. Maybe we need to steal from there, also in Zimbabwe, and start that TB Summit for ourselves. Because you need something in country that brings everybody together, that highlights that this is a serious problem, and we need to be looking at it. I was actually talking to my minister. I'm so sad he's not here. He had promised to come. I was saying when we went to Durban, to the AIDS conference, before going to Durban, there was a pre-Durban meeting that was held in Zimbabwe. And in our team, there were 3 journalists who appeared there from different media houses. And they were posting every blessed day we were in Durban. People at home will be saying, oh, you are doing a good job, you guys, every day you're appearing. And then yesterday there was a press conference here, and the union only invited the journalists from Asia. This poor Indian journalist even tried to look for an Indian minister, there was none. And that is a shortcoming on the union. Because this is how we are trying to remove TB from under the table and put it on top of the table. And you will not do it you can only do it if you then publicize it. Push it out there. Say there's a problem. It kills. This is it, whatever you're going to say. But don't say it under the bed. You have to come out and say it. There's a saying in the Bible that says you don't turn on a light and then put it under the bed, because nobody will see it, and it won't light your room. And that's exactly what we should be doing. Back to my parliament, I launched a parliamentary caucus in my parliament in Zimbabwe. I must thank my speaker for being very supportive. And I must say also it was easy because I chair a committee on health. Once I had sold the idea to my committee members, they all signed up and everybody else got interested. I must also thank the union director in Zimbabwe, Dr. Zishiri, thank the TB Challenge, and the World Health Organization. They have adopted the caucus indirect. They actually include money on the budget, and they didn't even tell us. It was just about 3 weeks ago that they phoned me and said, you have money for a workshop for the TB caucus members. Can you select about 30 so that to sensitize them, tell them, so they can come up with a plan? And we came up with a plan. What is our plan? Our plan in 2017, as a national caucus, is we will target prisons. We will target mining communities. We are going to have a march, and we have told our, I don't know whether to call it, I don't want to call them financiers. Maybe we should call them our surrogates, I'm not sure. We have told them to prepare for that, and they've said it's not a problem because there's not a lot of money involved. So what I'm trying to say is there's goodwill out there, and a march involving parliamentarians will be something else. At the end of a march, we are hoping that there will be a mobile clinic somewhere in some slum. That's where we are marching to, where they will be testing. So the mere fact that parliamentarians are marching, the whole town will march with them. They just love it. I know what it is, my country, when you are crossing the road. People stop you and say, MP, Linjani, how are you, MP? We saw you on TV. So that helps us a lot. But we just have not been using it effectively. So that's part of our program. And then I co-chair the SADC, the Global Caucus. I'm the co-chair for the Global Caucus of Parliamentarians Against TB, representing SADC. In next week, the plenary for SADC begins in Zimbabwe. And we have asked for a slot. So we're hoping to have a cocktail or a dinner where I will present the whole Global Caucus to the rest of Africa. The plenary goes on for 2 weeks, but I've just asked for 1 day. And then that is our contact, and I'm hoping and I'm praying. I've just been meeting with civil society from South Africa. They've promised me that by June, South Africa will launch. Botswana is launching soon. Namibia should be launching soon. And I met a lady from Zambia, Caro. She has promised me definitely by June. So we are targeting 7 countries by June 2017 to launch our caucuses and be strong. And I've just come from a meeting where we're discussing the Ghana Africa Region Union meeting. And one of the things we proposed in that meeting was that let's mobilize the same tycoons from Africa who actually raised the money for Ebola. I know a lot of people don't know that happened. I know because one of them is a Zimbabwean. It was Dangote, Motsepe, and Strive Masua from Zimbabwe. They each raised $1 million for Ebola as business people. So I said, let's invite them. Don't ask for money. Invite them to Ghana. These people are anthropologists. They love doing things like that, but they want to see, because they're business people, they don't want stories. They want to come and hear and see. Let's tell them that there's a problem. Yes, Ebola is gone, but there's something called TB that is going to kill, that is killing people whom we have invested ARVs in, and when we just think we are getting to 90 for HIV, we will not get there because they'll be killed by a worm called TB. South Africa already is reporting that 80% of the HIV deaths last year were due to TB. That tells us we have a problem. There's no goal between these two goals. If we don't work with them together, we will achieve none of them. And as we move, we are hoping as parliamentarians, in my forums, wherever I go, I used to be the president of the Confederation of Zimbabwean Industry in my region. So I do have contact with business people. Even though our economy is not doing well, there are certain things, certain individuals, even if they can't do it themselves, they could connect me to one or two other people. So we are hoping to advocate for the vaccine. I know Aras there is desperately trying to get money for the vaccine. I believe if a vaccine could come out anytime now, it would definitely achieve our SDGs. But our SDGs, unfortunately, are linked, so closely knit together, that we really cannot afford to deal with one issue, especially the HIV, because they've been given the money. Somebody said TB is an orphan. I don't call TB an orphan. It's a stepdaughter. It's a stepchild to a mother of HIV, which is the UN. And so the little money is given to this stepchild, and the other child is next after. But information needs to come out very clear that we need to look after the stepchild as well as we are looking after the real child. Thank you.
Thank you so much. I think we're going to change the order up just a little bit. Next, we're going to hear from Rahab Waniki from KENCO, the Kenya AIDS NGOs Consortium. She's going to talk about how, as a member of civil society, she's been working with the TB caucus in Kenya and her work with Stephen Mule. And then press it here.
Good afternoon, everyone. My presentation is very clear on the best practices on how Kenya has managed to use the TB caucus in Kenya to champion issues of health in Kenya. So we're using a model called Grassroots. It's by resorts, and it has been piloted in other countries like Australia, US, in Zambia, and also in Kenya. So the goal of the citizen engagement is just to ensure that devolution takes place in Kenya effectively. Health is one of the devolved functions from the last government, the current government that is in power. And one is to ensure that citizens become valuable and trusted source of information and real-life stories. The other goal is to build and establish relationships between elected members of parliament, senators, and members of county assemblies. It's not easy for an ordinary citizen to just approach them. They have that space. It may be easy in these developed countries, but for us in Africa, you have to go shake hands, And then there's also this perception that anytime I want to approach my member of parliament, I'm asking for harambe, or I want somebody sick, there's a funeral, there's a wedding, And we need to change that mentality, because I think if you do the microeconomics, if the systems in health are working well, we don't need those harambes. Harambes is fundraisings. So we are non-partisan. Non-affiliation will work with any political party. Honorable Mula is in the opposition, eh? So even Honorable Ruth Labode. So we are non-partisan, non-affiliation. We are community-oriented and focused. And we also adhere to issues of integrity. It's very important when you're doing advocacy, especially politicians, that issues of integrity are put in focus. We are keen on issues of addressing critical decisions, especially on health. We are looking at low investment in child health, issues of BCG, issues of stockouts for ARVs or TB drugs, or issues of tetanus, so anything on child. And for this one, we are talking of BCG. I know in the last 2 weeks, we've been having shortages of BCG needles. That's a challenge. So it means any child, any mother giving birth to a child, the child goes back. You're not sure if they'll come back for the BCG shot. We also look at issues of budgets, analysis of budgets at the national and county level, because that is where we need the information from. Then we analyze also the issues that we need to address as citizens. So how it's been structured is that the citizens are not paid. They're not given any allowance. They do their own meetings at the ward level. So they meet every month. They analyze the issues in the community. It could be water. It could be poverty. It could be agriculture. It could be issues of sanitation. But for us, we are focusing on health. They will write letters. They will not type them. I'll just show you a sample of the letter we do. They will book an appointment. They choose a leader who books an appointment with a member of parliament, with a senator, and the appointment could even be in a restaurant, anywhere. They meet the people. And then every year, they develop county scorecards. You need to see if our budget is ready in June. So by the time it's coming to July, they have to evaluate how far has the county government helped in championing our issues after we met the member of parliament, the senator, or the member of county assembly. These are grassroots advocates. We have 13 counties out of 47, and they are in various areas. But some of these counties is counties where we have high TB burden and high HIV burden, and also issues of poverty. So after we have identified grassroots advocates, we do advocacy skills training. It's very important. How do you present yourself to an elected member of parliament and ask for genuine developmental issues? Because health is a developmental issue. We also assess overcoming barriers that prevent citizens from engaging elected leaders. I would say maybe I'm very poor, so how do I approach my member of parliament? So we also look at those barriers. We do face-to-face meeting with the members of parliament. This is, you may not see well, but on the extreme left, the second person is Honorable Neto, a member of the Health Committee and also a member of the Human Rights Caucus, meeting with Grassroots. Below, you see Grassroots sitting on benches at the health facility in one of the constituents. Kangemi, this is Kangemi. It's one of the informal settlements. This clinic is in the informal settlement, so they write letters. And this is a sample of a letter. Looks very neat, with very good handwriting. And this is from one of the grassroots champions who is 11 years old. And for us to use such a champion, the mother has to consent, or the guardian has to consent. And this boy, this letter was written last year. It was issues of pediatric treatment. He wrote to the cabinet secretary. And we didn't know that Kenya would be one of the first country to roll out the pediatric treatment. So at the launch, which was in September, he was one of the key speakers. We also want to mention some of the successes we've had with members of parliament, and mention particularly Honorable Stephen Muller's contribution to bridging the gap between civil society and the legislators. you may recall that Barcelona Declaration was signed in 2014. And so Honorable Mule attended that meeting. He liked the idea. He was very passionate about it and said it has to happen in Kenya. So he went to Parliament. And on that day, members of Parliament wanted to vote out the Speaker. So he ensured to put in this agenda as a first agenda so that the MPs can dispense this agenda quickly on signing of the declaration on TB so that they can go to the next vote of kicking out the Speaker. And it is where we realized 133 members of Parliament signing within a very short time in terms of agreeing with what the declaration, Barcelona Declaration, and their desire to be TB caucus members. And that was something remarkable because no other country had achieved that. So how we track these successes is through Hansard reports, which are online. These Hansard reports, we had a stock out of TB drugs, and we approached the health committee, and we told them that in the next month there'll be no TB drugs. So we have one member of Parliament, also a member of the Finance Committee, Honorable Shakil Shabil, and he brought the agenda onto the ground and said, we have TB drugs, stock out, and people will relapse. And therefore, we borrowed the drugs from Malawi. We were happy Malawi gave us, because I think they had excess or they hadn't used, but we got the drugs. And the involvement of such people from other committees is because Honorable Mule has been able to whip them and sensitize the members of Parliament in terms of the issue of TB in the country, the issue of pediatric, and we really support and appreciate his role in Parliament. So that's what I want to share, and I call upon you to sign up for the Step Up for TB so that we eradicate TB in Africa and the world. So thank you.
Thank you so much, Rahab. And please stay up here because once all the presentations are done, I'm going to ask our panelists to actually sit up here to answer questions. But I would like to call on MP Helen Tan next, who is an MP from Vietnam, the Philippines, sorry. The Philippines, but also is the co-chair of the Asia Pacific TB Caucus, which was the first regional TB caucus that was founded last year in September 2015 at the Union's Asia Pacific Regional Conference. So thank you so much for being here. She's going to talk a bit about the work that she's doing in the Philippines, but also how she's translated that work at a regional level and why regional work is very imperative to combating this disease.
Can you see me? I'm so sorry. Thank you very much. Good afternoon. Thank you for giving me the privilege to speak before you today on the subject of taking action at the political level to tackle tuberculosis, which in a few minutes of my talk will explore my firsthand experiences, challenges, and successes that I have drawn from my personal advocacy of ending tuberculosis in my country and my journey to the Asia Pacific TB Caucus. In August 2015, a meeting of 13 parliamentarians from 9 countries of the Asia Pacific region and UK met in Sydney, Australia, to form the Asia Pacific TB Caucus, which saw the election of Honorable Warren Entsch and myself as the co-chair. It was in this historic event or a gathering that the members of the Asia-Pacific TB Caucus vowed to take action both collectively and individually to drive progress against TB by working with the national parliaments and regional and global organizations to build support for the necessary policies and to mobilize resources to effectively tackle the disease. As a lawmaker and a medical practitioner, I am often asked, why tuberculosis? And my answer is simple. Tuberculosis is a disease of poverty, and the development and decay of our society will be mirrored by the very action that we put to stop this ancient disease. If I may quote John B. Huber, an American public health physician, he once said, "The tubercle bacillus is an index by inversion of the real progress of the human race. By it, the claim of civilization to dominate human life may fairly be judged. Advance of civilization, tuberculosis will decrease with the substantial advance of civilization, and the disease will assuredly increase as civilization retrogrades. Whether or not our present or civilization will eventually make progress or retrogress will be seen in part in our collective effort today to stop tuberculosis. In response to the need of filling the nagging gaps and loopholes in our health system, especially the stagnation of TB budget level through the years and suboptimal utilization rates, insufficient number of health personnel working with TB patients, qualitative and quantitative TB drug problems, inaccessibility of TB services, and governance issues. I have introduced a bill to efficiently implement the necessary measure to arrest the spread of the TB disease. It is my belief that a more comprehensive strategy is needed to strengthen the fight against tuberculosis. And I'm very pleased to inform you that this measure that I have presented in Cape Town, South Africa, which I personally spearheaded in the Bicameral Congress of the Philippines, is now a landmark law or a landmark piece of legislation known as Republic Act 10767, or the Comprehensive TB or Tuberculosis Elimination Plan Act, which was signed by our former president last April this year. This landmark initiative is part of my two-pronged approach to TB elimination in the Philippines. The other one is a project which I spearheaded that aims to eradicate tuberculosis by bringing TB diagnostic services right at the grassroots level through the provision of free chest X-ray, medical consultation, and sputum screening to marginalized TB suspect patients. Next year, we will be bringing a gene expert at the grassroots level to hasten case detection. According to 2015 Global Tuberculosis Report, the Philippines is one of the 9 high TB burden countries that have attained the MDG goals, or the MDG, of decreasing the trend of TB incidence rate and decreasing by half the mortality rate and prevalence rate. This notwithstanding, it remains one of the 30 high TB burden countries listed by the WHO. But as of the latest review, case notification is increasing, which is good. At least we can provide cure to these TB patients. Currently, we are now using the new drugs and new regimens such as bedaquiline and the introduction of the 9-month treatment regimen for drug-resistant TB cases. It is also significant that the law, the anti-TB law, is in place. This law squarely addresses, or it essentially seeks to address, the persistent problems besetting the current efforts to eradicate tuberculosis in the Philippines. It escalates the fight against tuberculosis with the use of bolder terms such as comprehensive and the use of the term eliminate instead of control, consistent with the new global strategy. It evidently reflects the needed change in attitude and action from controlling tuberculosis to ending TB and saving lives alone to stopping transmission as well. One of the challenges, the critical part, I believe, in the implementation of anti-TB law is to secure adequate and sustainable funding in the face of continuous unmet funding needs against tuberculosis. Since the law was just recently enacted and its implementing rules and regulation is still in the drafting process, the full budgetary effect of the law will only be reflected in 2018, where we expect a significant increase in the anti-TB budget appropriations. Currently, the proposed budget for TB control in the Philippines is around $27 million US. As budgetary gatekeepers and members of parliaments, the members of parliaments must help ensure that the annual national anti-TB program are continuously and adequately funded. We need to be able to help bridge the gaps in funding anti-TB activities, specifically in terms of funding priority areas such as expanded diagnosis and effective treatment for drug-susceptible TB, MDR-TB, rapid diagnostics and associated laboratory strengthening, TB-HIV collaborative activities, and research and development. The issue of funding juxtaposed to the objective to scale up and sustain coverage of directly observed treatment short course, or the TB-DOTS implementation, and to ensure provision of quality TB services already creates a substantial financial burden. In the Philippines, the strategy alone on addressing MDR-TB, TB-HIV, and the needs of vulnerable population, along with the regulation and making available quality TB diagnostic tests and drugs, already accounts for more than half, 70% to be specific, of the total cost of the Philippine plan to control tuberculosis. This is understandable because MDR-TB, which means resistance to two of the most effective first-line drugs, rifampicin and isoniazid, is more difficult and costly to cure. MDR-TB is indeed a big problem in as much as the cost of drugs for treating the average MDR patient is 50 to 200 times more than the drug-susceptible TB. MDR-TB takes at least 3 times longer to cure, and it has a higher mortality rate than the drug-susceptible TB, which means due attention to combating this particular TB type is significantly vital, especially because addressing these expensive problems requires a corresponding expensive solution, which is research and development. I am convinced that in the face of our huge financial resources needed each year to fight tuberculosis, there is a need to bring together members of Congress and even local legislators, budget executives, finance experts, and funding organizations to exchange notes and build collaborative efforts in order to bridge the funding gap, especially for the treatment of MDR-TB. We need to raise awareness for the increased investment demands in fighting tuberculosis to help address funding problems. It is estimated that an investment of $1 TB care yields a return of about $30.2 or even as high as $115 for each dollar invested. One of the critical ingredients of enacting an anti-TB legislation is ensuring that health authorities and other relevant authorities that are tasked to implement the measures necessary to control TB are properly engaged and efficient framework to coordinate their effort are in place. Policymakers must help institute the legal basis for the implementation of various measures and practices that are deemed important in combating TB and facilitate the cooperation of various sectors. In other words, we must use the full strength of oversight and accountability tools at our disposal. Soliciting the support opinions and expertise of government executives working on tuberculosis is critical in ensuring that an anti-TB legislation will be successful. In hindsight, my role as a legislator was in fact to provide our TB manager and those organizations working to eradicate tuberculosis a tool and a venue by which they can advance the fight against tuberculosis. The bill that I have drafted serve as their tool in crafting a more comprehensive piece of legislation via the legislative executive conferences that I initially arranged with them and Congress, starting with the Committee on Health, serve as a venue by which TB workers can freely express their findings and opinions in reversing the rate of TB incidences in the Philippines. Since Philippine Congress is bicameral in nature, there was a need to reach out as well to our counterparts in the Senate. So I had to lobby with our senator, and one senator agreed to file the bill in its entirety, which eventually fast-tracked and ensured in its enactment. Inside Congress, I have to capitalize as well on the influence and support of my close friends and colleagues who helped pass the measure as a co-authors. There were 50 co-authors of the bill by the time it was unanimously passed and approved in Congress. The Barcelona Declaration, which I had met the members of the Philippine legislature sign after I delivered a privileged speech to call attention to the pressing problem of TB disease, also helped a lot in generating the needed political will and commitment on the part of our lawmakers. A few days before my scheduled flight here in Liverpool, there were already 112 members of Philippine Congress who had pledged their support and affixed their signatures at the Barcelona Declaration. My close engagement with various TB organizations like Philippine Coalition Against Tuberculosis, it's a 63-member coalition of government and non-government organizations, academe, medical and non-medical professional societies, research organizations, patient and advocacy groups, corporate foundations, and pharmaceutical companies, and other partners in TB control. This paved the way to heighten awareness and embolden cooperative action on the need to stop TB through various conferences such as those commemorating the World TB Day in the Philippines. Anti-TB advertisements in the Philippines that proliferated in television, radio, and print ads also help a lot to raise the awareness of legislators and public on the extent of TB problem. Henceforth, the Comprehensive Tuberculosis Elimination Plan Act will now serve as the basis in the formulation of the National TB Strategic Plan for 2017 to 2022 in support of the Philippine Health Agenda and the Global End TB Strategy. And I am hopeful that this will make a huge impact in our strategy to stop tuberculosis in the Philippines. With this, allow me to end by saying that we must all realize that there's no easy way that we can stop tuberculosis or eliminate tuberculosis in our lifetime. But it can be done. Together, we can make a difference in the global fight against tuberculosis, and we have to do it now. Let's join forces to stop TB. Thank you and good afternoon.
Thank you so much, and congratulations on getting that bill drafted and passed. It's not an easy thing to do in pretty much any parliament. I'd like to call on Matt Oliver, who works for the Global TB Caucus, to share a bit about what the Global TB Caucus is, the different regions and participants that are involved, how you can get involved, and how they set a common agenda, some plans for this coming year.
Hello. I feel like I should caveat this by saying that I have two challenges today. The first is obviously that I am speaking on a panel with a bunch of professional public speakers, so be gentle. be more gentle because 3 of them are my bosses. So I'm going to do the best thing I can and keep this brief. My task here is to talk a little bit more about how the Global TB Caucus came to be. Nick will talk about it a little bit more in a moment, but before I was working for the caucus, I was the secretariat of something called the All-Party Parliamentary Group on Tuberculosis in the UK, which is basically a national caucus. And one of the first things that I did in that role was I had a meeting with a politician, a parliamentarian called Nick Dakin. And I said, well, you see, the problem is there just isn't enough political will. And he looked at me and he said, do you think we're just walking around a bunch of people without political will? Someone's got to tell us what to do. It's not like we have time to search the internet and see all the statistics and decide that TB is the most important issue, or that we somehow pick up the gravity of this situation by osmosis. And after I'd looked up what osmosis meant, I sort of sat back and realized that we really did need to take a very different approach to the way that we work with parliamentarians. And the Global TB Caucus is an extension of that. But essentially what it starts with is asking them. You can't expect some incredibly busy people who have, to be honest, full-time jobs that are more than anybody would want to take on, to just pick up a campaign and run with it out of I don't know, well, hopefully the goodness of their hearts. But you certainly have to ask them and tell them why it's so important. And when we came up with the idea of the Global TB Caucus and then launching it in Barcelona, the Barcelona Declaration is many, many things, but very simply, it is a way of asking as many parliamentarians as possible whether they're willing to get involved in the fight against TB. And it turns out that there are a lot out there, like Helen and Ruth, and obviously Nick was a driving force, and Stefan and Sarah. I think I've named all the MPs in the room, just to make sure I don't get in trouble later, that were willing to do it, that recognized that this was important and it was something they wanted to give their time to. And so my job then is to support them and to make sure that with the limited time that they have available to act on TB, they take their actions have the absolute maximum impact. But everybody in this conference, and in fact everybody who works on TB, also has a role to play. And I think, just as that MP said to me, you know, you have to ask us. It's not that we're walking around lacking political will, it just needs deploying. I would challenge you during the rest of this conference, anytime you're at a presentation, put your hand up and ask the speaker why it is that they think that on their specific issue that not enough progress is being made. And I guarantee one of the things that they will say is, there's not political will. And if they'll let you have a follow-up, just ask them, have they ever personally tried to engage their parliamentarian? And given that there are 3,500 people at this conference, and this is, I think, the only session with political will in the title, and this room is not full, there's a lot of people who are saying that political will is the problem, but they don't seem to be taking an active hand in finding a solution to it. And so, when we talk about what the Global TB Caucus is now, we say, you know, it's a network of 2,000 parliamentarians, more than 2,000 parliamentarians, in 130 countries. There's 4 regional networks. We've already set up 15 national caucuses. We're trying to set up more. The impression that we give is that this is a movement of parliamentarians who are all firing 100% on their own with no support. But there are a hell of a lot of people who are working. Some are paid to, but most voluntarily with their parliamentarians to give them the support that they need because they know that this is important. And they do it on the side of other jobs. And they do it in addition to the things that they have to do and all of their, you know, other responsibilities. And so those people should also be recognized too. And there are a few people who are doing those roles here in the room. And I won't name you because I won't embarrass you, but thank you. They are going to play a much more important role in the future of the Global TB Caucus than I or my secretariat team. Because what we want to do in the future is make this a truly sustainable, bottom-up movement, led by national caucuses in the high-burden countries and the G20 countries, who can really drive this agenda forward. And when there's an election and parliamentarians, as they sometimes do, lose their jobs, they'll be there to make sure that there are new people who will take up the fight. And civil society stays. Parliamentarians move on, they lose their jobs. Sometimes they get promoted, and when they do, it's great for us if they've been part of our network. But it really is civil society that's going to make the difference. And that means that all of you also have a role to play. So I don't know, I'm going to do a little bit of audience participation because I'm like that. Put your hand up if you know that there's a national caucus in your country. Okay, put your hands up if you don't know whether there is one or not. Please find out. And for those who do know, please engage with them. We cannot do our job without your support. And you would be surprised at how much difference, as Rahab said, you'd be surprised at how much difference it can make. Sorry, you're down here now. Just to send a letter to a parliamentarian. And if you're not sure how to start the conversation, if it feels kind of awkward to write to a random MP and say, you know, you should be doing this, you can start off by saying thank you to them. Most people like being thanked. And a lot of the time, parliamentarians don't get as much thanks as they should. Some don't deserve any thanks whatsoever, don't get me wrong, but there are a few that do some good stuff. And ask them to sign the Barcelona Declaration, and then once they've done that, thank them, and then continue on from there. And if you're not sure how, go to www.globaltvcaucus.org or ask me for a business card, and we would love to work with you and to help. The future of the Global TB Caucus and the Global TB Response will be driven at national level by national governments. That's the only way that change is really going to happen, and that means I can't do it. Even my team can't do it wherever we are. We don't know what needs to be done on TB in Georgia. We need Georgians to do that, working with Georgian parliamentarians. And it's the same for every other country. So thank you very much for your time. Please do get involved. Come and talk to me later if you don't know how and you'd like to. Yeah, give a good reception to the MPs when they leave. Thank you.
Thank you so much. And last but not least, I'd like to call upon MP Nick Herbert from the UK, who is a founding member of the Global TB Caucus and co-chair of the Global TB Caucus, who can tell us a bit about the history, but also I'd ask him to share a bit about what is important to talk to MPs about. How do you get their attention on TB? You know, are you talking about correlates of protection and biomarkers, or is it something else?
Well, thank you very much indeed, Mandy. It's a pleasure to be speaking at this meeting, and one chaired by you. And can I, first of all, just extend my apologies to anybody who's heard me speaking before on this issue, or particularly at this conference, because I probably am going to repeat myself. But actually, the first rule in politics is that you go on repeating yourself. I was once told by a very senior politician that only at the point where you are becoming so bored of repeating yourself that you think that everybody must have heard what you said, might there be the possibility that what you say is beginning to cut through. And very often in politics, actually, we make passing comment and believe that we will have made our point, or that it will have been universally heard. And that is usually not the case, unless indeed one, as a politician, says something very stupid, in which case a single passing comment is enough to earn opprobrium and indeed infamy. But usually it is not, and politics is about repetition and building support for propositions, and that, I'm afraid, does involve repetition. So that's my apology in advance. Let me, as invited, just talk a little bit about how I got into all of this and how we then came to build the Global TB Caucus. And then I'll talk a bit about how you influence members of Parliament based on that experience. So I've been a member of Parliament in the UK Parliament for 11 years. And shortly after I was elected, I was invited by Results UK, supported by the Bill Melinda Gates Foundation, to go on a visit to Kenya to look at HIV, AIDS, and TB. I was interested in HIV, AIDS, and I wanted to go on the trip, so I applied to do so, and I was one of 3 MPs that was accepted on the trip. It was a cross-party delegation. I knew nothing about TB, and being a member of Parliament, I didn't read any of the papers that I was sent beforehand. And members of Parliament, by the way, here's my first tip: never read long papers that you send them. I went along and attended my first meeting And I put my hand up in the meeting. I said, but surely you can just vaccinate everybody. Why is this a problem? And everybody laughed at me. And I learned about TB in the course of that trip. And I saw at the time things were going very badly backwards in Kenya. Life expectancy was falling. The disease was taking a hold. HIV/AIDS was taking a hold. There were very dislocated efforts to deal with it. And I came back to the UK Parliament, and the thing that really struck me was that everybody in the Parliament was talking about HIV/AIDS, and they were talking about malaria. We had committees, cross-party committees, to promote action to tackle those diseases. And there was no cross-party committee to promote tuberculosis. And that in itself, I think, was very telling. TB, as I said at the union dinner earlier this week, is the orphan disease, which has little political support or attention. And because of that, we thought that we needed to set up a cross-party committee in our parliament to promote the need to take action to tackle TB. And we focused not just on the global agenda, but also on TB domestically, because the UK has relatively high rates of TB for a Western country. And that committee succeeded in raising the issue on the agenda of the UK government. It was cross-party in its nature, so whoever was in power, we were able to talk to them. And we depoliticized the issues in the sense that they weren't a matter for partisan debate. We worked together across the floor of the House, or what in the US they would say, across the track, in a bipartisan manner, so as to raise the issues. And we succeeded in persuading the UK government to adopt a public health strategy to tackle TB. You may have seen the van that was parked outside the conference, which is part of the outreach that the NHS now does to ensure that it's finding TB, people who might have TB and diagnosing them. And that's all part of the Public Health England's new TB strategy that we are urged in our committee. And then we also sought to persuade the UK government to do more in terms of its international agenda to tackle TB as well, including through the replenishment of the Global Fund, but also through its bilateral programs in R&D and so on. And we've got work to continue to do on that. And I think it's, despite having relatively little parliamentary support, because it's not a fashionable issue in a parliament, we managed to punch above our weight, partly because I think we were publishing very serious reports and persuading the government and officials of the need to act. And it was that insight, it was seeing what we were able to achieve as a small committee in the UK Parliament, and that made me think that what we should try and do was tie up with other parliamentarians who I was meeting on an ad hoc basis at conferences like this globally, and to see whether we couldn't collect together, pool our efforts, and make more of an impact, particularly when so much of what we now need to do requires international cooperation. And so 2 years ago, in Barcelona, at this union conference in Barcelona, a few of us collected together. We decided to form a global TB caucus. We set out a declaration which became known as the Barcelona Declaration. And as you've heard, that has now grown to the point that we now have over 2,000 parliamentarians supporting that in 130 different countries. We have 4 regional networks in Asia Pacific, Africa, Europe, and the Americas, a Francophone network as well. And we're really building support for this caucus. And the aim is not just to create a network and think that that's enough. The aim is to get the network doing things and to weigh in behind the action that needs to be taken, and to support the creation of national TB caucuses in as many countries as possible. So there were only 5 when we started, and now there are 15, and we want to grow many more. We hope there are another 10 on their way, and we've recommitted at our meetings this week to try and increase the number of national caucuses, increase support for those caucuses from parliamentarians in different countries, and work together to support what the global TB community is saying. So there needs to be more resource for TB. There needs to be more investment in R&D. We need this to raise up the global agenda, and effectively we seek to try and provide some of additional political support for that, because so much attention beforehand was focused on political leaders, ministers, health ministers, finance ministers, leaders, and less attention was focused on parliamentarians. But what you have to remember is that it's parliamentarians who often vote the money, who have a position in what Theodore Roosevelt called the bully pulpit. I'm standing at one now, the ability to take a public stand and to be listened to. We often choose leaders, unless they're directly elected, but we certainly rub shoulders with leaders. We have a great system in the UK. In our Parliament, we vote alongside ministers, including the Prime Minister, who we see in our lobby, and we can go up and urge that they take action on things. So parliamentarians aren't people to be ignored. Parliamentarians are people to be used, because in the end, we work for you. There's a website in the UK that is called theyworkforyou.com, and that monitors what MPs are doing, how often they speak in debates, what they ask questions about, and so on. And it's very aptly named, because in the end, we work for you. We're public servants, and it is our job to represent the people, and so on. But it's also our job to pick up issues that we believe are of concern and run with those and do what we believe to be right. So I always say to people, we are a resource to be used. You know, I sometimes joke with my constituents, I am a free public resource, please use me. And that isn't about being shouted at, it's about being encouraged to take action. I thought Matt was absolutely right when he made that point. And so a few insights that Mandy's asked me to give about how you approach members of Parliament. And although I can really only speak from my experience as a UK parliamentarian, I suspect some of these insights are true in other countries as well. Indeed, when we meet as parliamentarians from all around the world, even when there's a language barrier, I think we can often make common cause, because actually we find ourselves to be in the same sort of position. We are elected to our chambers. We have constituents, we answer to our constituents, we face elections, we face the same issues, and we find we make a common bond. So I suspect, but we'll find out because we can pick this up in discussion, I suspect that we face very similar issues and have the same sort of insights about what works with us and what doesn't. So first of all, may I say to those pressure groups that think they can influence us by pelting us with thousands of computer-generated emails a day, you do an enormous disservice to your cause. So sitting up in London and elsewhere around the world are people who are public affairs managers for pressure groups. And they think they're doing a fantastic job by buying some list and then machine gunning us with emails, or by encouraging their own members to email us on computer-generated emails that come to us. And so on. But I certainly, from my own view, is that actually not only can that is not effective in promoting a cause, it can often undermine a cause, because we discount that kind of lobbying effort, because we know that it's not really driven by real people. It's driven by somebody sitting on a computer and so on. And it's very hard to assess simply on a quantitative basis, just because somebody has clicked a mouse that they want to send me an email. It's very hard to assess how strongly they feel about an issue. And we have people who will just click their mouses repeatedly on a series of issues, literally day after day, and pelt us with the emails from all sorts of different causes and so on. By contrast, if somebody writes individually to us, if somebody comes to see us in the surgeries that we hold, they're called surgeries in the UK, where we actually meet our constituents, and comes and talks to us and says this is an issue of concern, that makes much more of an impression on us, because we know that that's the view of somebody that is expressing a view that is personal and heartfelt and is a call to action. Somebody came to see me in my constituency 2 weeks ago. You know, very often they'll raise local issues which are important about local public services, the school or the hospital, or something that's very personal to them about some difficulty they've had. And we will always try and help. But in this case, they raised a global issue, actually, which was the plight of Syrian refugees. And this person spoke with great insight, because she had been and helped in the refugee camps. She knew what was going on. She was very well informed about it. And that made an enormous impression on me. It's an issue I happen to take an interest in, but I learnt a lot from the meeting. So I do think that going in and seeing your members of parliament and talking to them about the issue, speaking with insights and experience, and encouraging members of parliament to take a stance is important. And I make this plea constantly to the medical community to please engage with your members of parliament. I think the medical community sometimes despair of politicians and don't want to get involved in politics, and I completely understand that, but it is important to engage with parliamentarians. So last week I went and visited a TB clinic in London, the Royal London Hospital, and I met clinicians and I talked to them about the issues that they face. Extraordinarily, remarkably similar issues, actually, to the issues that might be faced in a high-burden country. The same sorts of challenges. How do you find patients? How do you follow up? How do you diagnose correctly? And actually, I learned an awful lot from that meeting. And they're very busy clinicians, but it was a great opportunity for me to learn more. And I hope it wasn't a waste of their time. And I do think personal contact, sending personal briefings, not believing that everything can be done by shouting, but actually that things can be done by encouraging, particularly on an issue where you're encouraging members of parliament, often in countries that don't have TB or don't have high rates of TB, to take action because it is right to do so. Either it's morally right or because there's an imperative to do so because of the risk of drug-resistant TB in the future. Most of my colleagues in the UK Parliament don't see TB in their constituencies. Now, some do, and they take a particular interest in it. They're beginning to realise what's going on, but most of them don't see TB. So the kind of approach that needs to be taken to them is very different to that on other issues. So I would always argue for going in and trying to meet elected representatives. And I do think that Action and Results are very good at this. And I've worked with Action in DC, where I've gone in with them to see elected representatives, congressmen and senators, and so on. And I've watched as their activists go in and see people. And that really, that is a very effective way of driving action. Now, I appreciate that there are different political systems. Some members of parliament in some countries represent a huge number of constituents, and so on. So there will of course be national variations, but I think the principle remains the same, which is always to remember that members of parliament work for you, and that they are a potential resource and potential allies. And out there might be more people, such as the people who you've heard from today, the champions who have picked up the issue and run with it, whether it's Helen's brilliant TB legislation that she got passed in the Philippines, or Ruth's efforts in Zimbabwe and then across Africa through the caucus, or Dr. Stefano Balnier is here, who's chair of the European caucus and is making great efforts in the Bundestag, but also across Europe with what we're wanting to do with the Europe caucus. These are people who have chosen to pick up an issue that may not be fashionable in their constituencies, that may not yield them any political dividend, but are doing it because they think it's important and because it's right. And so let me give you this one final insight. In a world where people are getting angrier about what's going on, angrier with politicians, where people are despairing and negative, where we see the worst kind of anger permeating through in international debates and in national elections, I believe in the power of people working together. And in the end, I think that's what we should do. I think politicians should work with civil society to try and affect an outcome that will improve the lives of millions of people and do good. And I believe in the power of doing good. And I do think that we should see politicians as people who potentially can do good, not as people who are the enemy to be shouted at. I think that there is a failure to act on TB because there is a failure to understand the importance of this issue. It's not a disease that's researched in the West. Politicians don't understand the impact of it, the significance of it, the need to deal with it. They need to be brought to that understanding. And that will happen best by conversation, not by anger. Anger can play a part where you're pointing to injustice. But if you want to engage with politicians, I think the thing to do is to work in partnership with them and to encourage with them. And there are these national TB caucuses that are beginning to be set up in every country, and that, I would argue, gives a potential opportunity for civil society to engage with those national caucuses, to encourage those members of parliament, encourage them to make a stand, and to have that model of partnership that I think has been so successful in countries where it's already been tried. Thank you very much.
Thank you so much. I'm going to ask all of the speakers to come on the stage so that we can do a Q&A. Oh, perfect. Rosanna, those are, never mind. Would you take one of the mics and pass it around when people, so if you have a question, just put your hand up and Rosanna is gonna come around so you can ask your question. As we're getting started, I think maybe I'll start with a question for Helen and for Nick. Both of you, your countries have had elections recently, and there's been changes in administration. How does that affect your ability to work as a parliament, and do you see the importance of working with MPs as a way to mitigate changes in administration?
Thank you for that question. At this time in our country, it's a transition period. And because the law was just enacted last April, I have to talk to the Minister of Health for her to bring the issue on tuberculosis in the Philippines to the President. So at this time, I am currently actively coordinating with the department and the CSO so as to, for the continuity of what I've started. And for the law, the implementing rules and regulation is already in draft. So I have to see if the intention of my law is in there. So I work with them, with the Minister of Health. The reason why she's here now is that I asked her to come over because it's very important that we work together.
Mm-hmm.
I think it's also worth saying, I mean, I made the point that it's always a good idea to be cross-party because then you can insulate yourself against the potential changes in government. And I think that you can identify issues where pressure groups can find themselves aligning very strongly with one political party in an almost partisan manner. You can understand why, because they feel they're getting more traction from that political party, they don't have traction from the other. But that's actually potentially risky because you allow then you get the wrong party in your eyes coming to government. Not only have you not got the relationships with them, but they might actively think that you are not helpful to them. So I think being bipartisan in your approach, and a lot of the issues that, if you look globally, have made most progress on a progressive agenda, it's where they have reached out in a bipartisan way and been able to affect a consensus about change. So that's the first thing. I think the second thing is, it is important not to have all your eggs in one basket. I think that politicians do come or go. They lose their seats. We've just had an issue in one of our new caucuses where a key champion lost his seat unexpectedly. Then they go. Then you've suddenly lost somebody. So you need to try and broaden the base as much as possible, to have as many champions as possible, because they can be promoted, they can lose their seats, they can be taken away for some other reason to some other cause. And so it's quite important to not rely on too few political champions, whether those are ministerial or whether those are parliamentary. It is great, of course, it's wonderful. What we want is leaders, ministerial champions, people who pick up the agenda and really do great good and so on. But you need to ensure that there are others, that the thing takes a hold in an institutional memory, and that there are allies. Otherwise, the departure of that individual from the key committee or from the position of power can cause a real hiatus. And so on. So I think that's why it's important not to always have a broadly based approach, cross-party, and trying to influence as many people as possible.
Okay, thank you. Just I wanted to respond exactly what Nick has just said. When we set up the Zimbabwe National TB Caucus, the speaker then called us and said we need to come up with some framework of some kind. He said exactly what Nikki said. He says it must be bipartisan, And also, that document will live on if anything happens.
Yeah.
And then, because I'm a regional co-chair, we then voted in a national chairperson from the other party. And there's a working group of 9 people, hoping that somebody will remain there to carry on the work.
Who in the audience has questions?
Thank you. Nuala Moore with American Thoracic Society and Stop TB USA. So as somebody who comes from a low incidence country and somebody who works with trying to educate and mobilize our US Congress on TB, I've found that one of the effective messages is the fact that TB is airborne and therefore everybody is vulnerable. So I know that, there have to be different messages for different countries. That's essential. Each country and, advocates have to use the messages that work for their own countries. So maybe for Nick and for Matt, if you find that, using the message of the fact that TB is airborne and that everybody's vulnerable, if you think that's a good message and you see it working for advocates in lower incidence countries.
And let's take one more question before. Okay.
Yeah, David Bryden with Results in the U.S. It's really just fantastic to hear about the work that you've all been doing, especially what we were just hearing about in the Philippines. So I just want to congratulate our parliamentarian visiting from the Philippines. If we look at at your health insurance system, PhilHealth, that's coming out and as I understand it, going to include coverage for MDR-TB treatment. That's something that really you're leading on. And as I understand it, now you are eligible for the donated medication, but I would imagine that at some stage the Philippines his income will rise to such an extent that you may no longer be eligible. So I wonder if that's something of concern, or if you look in the region, that may be something that will affect a country like Malaysia or some others. I know, for instance, in our region, I'm concerned that Mexico has said they're not going to buy bedaquiline for patients in their system. Because they're not happy with the $3,000 cost per patient, which to me doesn't sound like a lot, but then I'm not there.
So do you guys want to start by answering Nuala's question about messaging for low incidence countries, and then pass it on to Helen to respond?
Sure. Yes, definitely. Although obviously, I think that there's always a line to be trod around stigma. The other one, the other bit of messaging that I think works particularly well in low incidence countries is around drug resistance. We have a challenge to move in low incidence countries. We have to move the conversation from ministries of health to ministries of finance. And even when you're talking about development agencies, you also need to get the ministers of finance involved. And as Nick frequently says, parliamentarians respond best to pain. And the prospect of losing large sums of money is always a winner. So in the AMR agenda, there is a much more robust analysis of the actual cost and future costs associated with drug resistance. And we as the caucus will be doing much more with that in the coming year.
Can I just add to that I mean, I think it's always wrong to say something contradictory to a different political audience. I mean, that would not be the right approach. But it's perfectly proper to emphasize things differently according to the concerns that that audience might have. And I talked about working to try and persuade, for instance, people in the United States Congress of the need to take action. I think the kinds of messages that one might have to somebody who represents a district that has TB in it because it represents a city and perhaps there or who takes a strong interest in international aid because they take a very strong moral stance on the issue, might be different to the kind of message that might work for somebody who doesn't represent an area like that, but takes an interest in national security and so on, where the emphasis might be different, which is that here is an airborne disease, or someone who takes a strong interest in finance and say, actually, look at the kind of costs we're going to incur unless we deal with this now. So I think it's always proper to calibrate your message, and I think we should be smart about that, and so on. But it's never right to have a contradictory message, and I don't think there's any need to in relation to TB, because all of these things are true. There is a moral reason to act. There is a public health reason to act. There's a security reason to act. There's a treasury reason to act, and we should bring to bear all these arguments as appropriate.
Thank you very much for bringing that up. In the Philippines, the diagnostics and treatment of tuberculosis is covered by the health insurance, but under the health insurance law, they only cover the new cases. That's why when I drafted the bill, I look on what are the problems that we encounter on the implementation of the National TB Program. So I'm happy to inform you that one of the provision of the law is that the National Health Insurance will cover not only the new cases, but the return after default and the MDR TB. So we're hoping that by 2018, the PhilHealth will come out with the new policy on the coverage.
Who else has questions for our panelists? Well, I have one. As we've heard over the last few days, especially from Treatment Action Group, is that there is a massive funding gap for research and development for tuberculosis. So in addition to the financing gap that we keep finding for TB programs in country, there's also a financing gap for finding new tools to combat the diseases. And I'm wondering what role you think parliamentarians can take in trying to increase investment for R&D, both in countries that have really high income countries that have a lot of universities and scientific institutes, but also in high burden countries who would benefit most from these new technologies.
For our country, I must admit that one of the weakness of the Philippines is investing in research and development. Actually, we're not only in tuberculosis, but in all other aspects. So with the tuberculosis, the law actually stated that we should invest more, and hopefully me as a legislator in every budget preparation, I can work with the department to increase budget on that aspect. So as a legislator, we have that power of the purse because we approve the budget. So I think we can work with our colleagues to support, especially for me. Of course, this is my advocacy. I have to work with my colleagues and encourage them to support my advocacy.
For Zimbabwe, the government only supports operational research in relation to programs on TB. Mm-hmm. For that we lobby, and there's always money that is set aside for that. Every other research is applied to government by independent research institutions and universities. So, and we don't actually deal with that. But as Parliament, we lobby for the operational research that is carried on the program.
Back to the audience. Well, then maybe, oh, yes. Could you stand up? And, oh, here.
Well, it's more of a comment than a question, because I mean, I suppose if you're in Parliament, sometimes you might not be privy to all the research that is happening. That I'm just adding to your question, and probably it is also the responsibility of the people that are in R&D to ensure that the information on what's going on in the country gets to the MPs and it informs the advocacy. Yeah, I think that is just a comment, and I don't know if the MPs will have any view on it, if it's something that's currently happening or if it's something that needs to be strengthened.
I have a view on it. Sorry for jumping in. I absolutely agree. I think that there is a challenge somehow with making sure, sometimes with making sure that the level of the messaging or the framing of the messaging is right to be in such a fashion that it's useful for parliamentarians. Because of course, with so much information coming across your desk on a day-to-day basis, intellectually it's interesting to know various things are going on. But for it to be practically useful and to inspire action, it has to be framed slightly differently. That's not to say that we're perfect at that either. I think it's an ongoing process of refining. But I do think that there is, particularly in the academic communities, there can be a breakdown between the kind of messaging you need.
I think there was one more question in the back. Oh, sorry. Yeah.
Mine is more of, I don't know that I can say, a challenge to the Member of Parliament from Zimbabwe. It's pretty easy when we set targets that we know we'll definitely achieve. There's no challenge in that. She said by July 2017, we'll have 7 new caucuses. That's easy because she's already made the contacts. So I would, pardon?
Some I haven't.
Okay. I would like her to give herself a challenge by saying maybe 14, because we're talking about 10 months or something like that. By July, by the time we get to July, we'll be talking about 10 months, which in her target is less than 1 caucus per month. Huh? Yeah, something like that.
And then before we break, I do want to have one question for Rahab on community engagement. When you were looking for new parliamentarians to engage, what kind of person are you looking for? Do you find someone that's already on a health committee, that has shown interest, that has a background as a physician? Someone from a constituency that you have grassroots on? I guess, how would you go through that step?
For Kanko to identify a member of parliament, we first have to target what is the issue we need to address. If it's a health issue, then we look for, when the members of parliament are being sworn in, you look for somebody who has very nice speech, somebody who's not controversial, somebody who can walk and see the cabinet secretary on your behalf. You have to look for quite a number of qualities. Somebody you can access with a phone call, because these members of parliament have very many bodyguards. Even when they're walking, there are very many bodyguards are driven in very big cars. And you need somebody who is reachable. But again, you need somebody who's also knowledgeable. A bit, not so much, because you also need that the role we also do is just give them the facts, or just one sheet. You don't have to do 2-page. 2-page, they won't read the second one, and it has to be in bullets. They won't read that second one. So, and they want to do things that are achievable. Before we even push an agenda, we even consult them whether this can sell. It's a lot of consultation. It's a back and forth, and then somebody who can also come to a meeting without a pay, without a sitting allowance. So our MPs are a bit expensive. They are, I think, the most expensive in the world, but we have to look for people who can really reach to the community, and people who can go down for free with their own money or whatever, and just push our agenda. Yeah.
Then hand it over to Ruth. Yeah. 14 in 10 months. Just kidding.
No, I'm also commenting on this one. I actually feel the civil society abuses me. Truly, I have to be running out of parliament for 30 minutes to present somewhere, come back, and sometimes one day the speaker says, "What is it you keep going out, coming in, going out, coming in?" He asked me informal outside. And then I said, I went to open a workshop there. I went to sit in a panel at some civil society meeting. So with us, maybe because we don't have big cars, and because I also worked with the civil society before as a doctor, under the child marriage and other things. So there's that informal relationship with you. So everybody just thinks, come please, come please. That's what happens. My colleague there for 10, I take up the challenge.